I'm just saying today we're going to be talking on a few pointers for IV skills. So first of all, let me tell you who I am. I'm Dr. Miriam Smith from the Empowering New Nurses Show. And today, again, I'm excited that you're here. My new nurses, this is specifically for you. And so today, I'll be saying a few things on intravenous therapy skills performance. So one of the things that you must do, you must check your orders. Then you're going to check all the equipment that you need to have. You're going to make sure you have them. You have them together to perform. Then of course, you're going to identify your patient. Identifying the patient that you're going to do this for. And you might use different things for identifying your patient, such as the patient's name, the patient's ID number, of course, and the patient's date of birth. Those are three of the things that we use. Some institutions might just use two, some might use all three. Date of birth, name, and what did I say? Date of birth, your name, and it just slipped me. So you must be able to identify your patient with their date of birth, the MRN number. That's your medical record number. Just like that. So it's important. You must know who you're doing. First of all, you check your order. That is correct. Then you get out all the supplies that you need. You identify your patient. Of course, hand hygiene. And then if that's, you're going to put the IV, you're going to make sure you scrub according to the institution's policy. And you proceed from there. So that's very, very important. So those are the basic steps that you will take. You must check your order to see that it's needed. It's there. There's a reason. And then, of course, you gather all your supplies. Yes, you do that. And then you're going to, of course, you check your patient's ID. As I said, that you know that that's the patient you're caring for. And, of course, you move forward by explaining the procedure. And then you're going to perform your procedure, starting to. That's it. So basically, you have your manual, you can go back through that to make sure you're doing it right. And also, your support group, your resource person, like your nurse that you would have there. Of course, you're going to have other nurses who have had more experience than you. If you're not so comfortable, they'll help you to support you until you gain your skills. So that's great. Now, how can you contact me? Right? You can contact me through Instagram at Podcast Me. You can also contact me through YouTube, Miriam Amanda Smith. Yeah. And I'm on Apple, and I'm on TikTok and Facebook. Now, my book will be coming out, Empowering New Nurses. That is Nurses, the Guide to Empowering New Nurses. Yes. That's it. And I know there are pearls in there for you. So you're going to make sure you obtain one for yourself. Thanks for subscribing. Leave a beautiful, helpful, you notice I said helpful. I said helpful. As you have been impressed and learned from the information that's given, you can write something to help somebody else. Thank you. I appreciate you. Have a great day.